Older Adults and Drug Abuse by Bonnie Dixon. The Drug Enforcement Administration, DEA, in its infancy, began its fight on drugs in 1973 with 1,470 special agents and a budget of less than $75 million. 52 years later, it has grown to 5,000 agents with a budget of $2.03 billion. Despite resources and incredible amounts of money, it is a war it does not appear we will ever win. By the 80s and 90s, substance abuse had started to decline, but then a number of things changed. One of the most recent things that changed was the onset of COVID-19. As of June 2020, 13% of Americans reported starting or increasing substance use as a way of coping with stress or emotions related to the pandemic, according to the Centers for Disease Control and Prevention, CDC. Another thing that changed is that substance abuse, which amongst older adults generally declines as that population ages, shifted. Between 2000 and 2020, the number of older adults needing treatment for substance abuse tripled. At least part of the answer may lie in the fact that people who grew up during the 60s and 70s were far more likely to experiment with drugs while they were younger, and so it has carried over as they have reached their senior years. In fact, a 2020 Harvard study with the National Center for Equitable Care for Elders blames easier access to drugs, alcohol, and tobacco at early ages as part of the reason for the increase. Other reasons include improper drug use due to cognitive decline, potential prescription drug interactions, and attempts to save money by taking another person's remaining medications for the increases in substance use. Between 2009 and 2020, the National Clearinghouse for Alcohol and Drug Information, NCADI, an organization that monitors the number of people admitted to addiction treatment centers, found a 53% increase in people aged 55 or older who sought treatment for alcohol use. Substance abuse is not limited to the use of illegal drugs or alcohol. According to NCADI, the fastest growing addiction among adults 60 and over is the abuse and overuse of prescription drugs. As many as 17% of adults over 60 abuse prescription drugs. Prescription drug abuse is a manifold problem. One of the biggest issues is that it can be difficult for medical providers to differentiate substance use disorder, SUD, from age-related health complications. For instance, it can be difficult to distinguish between cognitive decline and substance abuse, as substance abuse can exacerbate symptoms from early stages of dementia or other memory or cognitive issues. In addition, treatment for adults 62 and older comes with challenges because pre-existing conditions such as hypertension, diabetes, kidney or heart disease can worsen as a result of addiction or withdrawal. Addiction or dependence on prescription medications leads to serious health problems such as falls, delirium, cardiovascular disease, liver problems, diabetes, depression, anxiety, cognitive impairment, and more. Even moderate substance abuse can be dangerous because older people metabolize foods and other substances at different rates, making it easier for drugs and alcohol to accumulate to dangerous levels. Add in multiple prescription drugs and dangerous interactions can occur. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, 3 out of 10 adults between the ages of 57 and 85 use 5 medications or more. Patients who misuse or abuse their prescribed medications increase their risk of dangerous side effects. Limited mobility decreases access to treatment centers or the ability to attend regular therapy or support groups. For those with access to a phone, tablet, or other electronic device, or with family members able to provide caregiver support, talking to a doctor online can be faster, easier, and less expensive than a trip to an office. While COVID increased services such as telehealth, many older adults do not have access to the necessary tools, resources, or skills to allow them to participate in virtual sessions. So, while those resources are useful to some, many continue to find the post-COVID world unfriendly to their health needs. Not having the financial resources to afford treatment or the medications needed for recovery is perhaps the hardest problem for older adults to overcome. According to the U.S. Census Bureau, the share of older people living below poverty level grew from 8.9% in 2020 to 10.3% in 2021. Aside from shining a glaring spotlight on the fact that Social Security and Medicare are not sufficient tools for lifting older adults out of poverty, it means many experience a scarcity of resources. An index called the Elder Economic Security Standard Index, often called the Elder Index, developed by the Gerontology Institute at the University of Massachusetts, Boston, found that the average Social Security check covers 90% of living costs in places such as rural West Virginia, but just 38% in urban areas such as San Francisco. The Elder Index estimates that an older adult trying to afford daily costs needs about $1,000 more than the average Social Security benefit, and those numbers are not considering extra items such as medical care or treatment. There's an old joke that growing old is not for sissies. Many of the reasons older adults misuse or abuse drugs ring true for younger adults or even children, but are aggravated by circumstances related to aging. For instance, social isolation is not specifically an aging problem, but it certainly is associated with aging. Work and school, family life, and relationships also contribute to a feeling of connectivity that can disappear as we age, retire, lose loved ones, experience disabilities such as hearing, vision, or mobility issues, and have children move on. But some estimates, more than 1 in 3 adults age 45 and older feel lonely in the United States, and nearly 1 in 4 adults age 65 and over are socially isolated. Perception often colors and determines how older adults view substance use. Earlier generations considered addiction a failure rather than a health issue. Older adults are often reluctant to either seek help or admit they need help as a result, and caregivers are often embarrassed because the person needing help is mom or dad. It's complicated by the fact that at the federal and state level, there are few indications that the government recognizes it has the problem it is. Most of the literature, public service messages, and advertising that has come out for the past 50 years or so is directed at children and young adults and completely ignore older adults. Steps to take to prevent substance abuse or to work with someone who has a problem include providing medical providers with a complete history of prior and current substance abuse. Keep a list of all current medications for regular medication reviews with a health professional. Toss out expired medications or ones that are no longer being used. Check with your doctor's office or pharmacy for proper disposal. Use a medication dispenser to simplify complex medication regimes. If you provide care for an older adult, speak to a health professional you are concerned about medication interactions. Keep an eye out for signs something else besides aging is going on. Some signs of substance abuse in older adults include weight loss, memory loss, irritability outside of the norm, anxiety, difficulty concentrating or making decisions, lying about drinking habits, signs of withdrawal, and hiding pills or alcohol. Take someone with you when you go to a doctor's appointment. Some medical providers send home discussion sheets covering what was discussed during the appointment, but it is always useful to have another person to remind you of any questions you might have had prior to the appointment, and then to help in making sure you understand what the doctor tells you. Only take your own medications. Taking medications that haven't been prescribed to you can prevent a doctor from understanding what is happening in your own health and put your health at risk. Keep your medications in their original containers and don't mix them. Keep them in a safe, secure location to prevent children or thieves from getting into them. The Administration for Community Living recommends these resources. Medication management programs can help prevent emergency visits. These programs offer education and helpful instruction on ways to efficiently manage your medicine schedule. Many programs are coordinated through local area agencies on aging. For more information and to find a local program in your community, contact the Elder Care Locator. Elder Care Locator 1-800-677-1111. Well, 1-800-677-1116, Monday through Friday, 9 a.m. to 8 p.m. Eastern Time. eldercarelocator.acl.gov. Launched in 1991, the Elder Care Locator is the only national information and referral resource to provide support to consumers across the spectrum of issues affecting older Americans. The locator was established and is funded by the U.S. Administration on Aging, part of Administration for Community Living, and it is administered by the National Association of Area Agencies on Aging, N4A. The Substance Abuse and Mental Health Services Administration's national helpline number is 1-800-662-HELP, which is 4357 for the last 4 digits. TTY, that number is 1-800-487-4889. Website, SAM-HSA.gov/find-help/national-helpline. This national helpline is a free, confidential, 24/7, 365 days a year treatment, referral, and information service in both English and Spanish for individuals and families facing mental and/or substance use disorders. Food and Drug Administration, their number is 1-888-INFO-FDA. That's 1-888-463-6332. And their website is www.fda.gov. The FDA provides timely, reliable health and safety information about food, drugs, medical devices, and more.